Hi, my name is Diana Valentine, and today I will be presenting my interprofessional collaboration project for spring of 2025. I did my preceptorship in the labor and delivery side at Cadillac, and so I will be discussing my patient's medical history, medical problems, psychosocial concerns, as well as their OB history. I'll be discussing the collaboration with lactation and how lactation consultants are involved in the patient's breastfeeding journey and a huge part of the birth center. I will also be discussing my collaboration with midwives and how they are involved not only in the delivery of the baby, but as well as a follow-up in the postpartum phase of care. And then I will be discussing recommendations for quality improvements. My patient was a 28-year-old female. She was a full code. She was admitted on May 1st for an induction of labor due to gestational diabetes and a BMI greater than 30. So we'll discuss her OB history. She was a G1P0, meaning this was her first child. She was 39 weeks and 0 days. Her estimated day of delivery was May 8th, 2025. She had no known drug allergies. She was GBS positive and her blood type was A positive. Reviewing her delivery summary, she was induced at 1839. Her labor onset started at 1700 and she had a spontaneous vaginal delivery at 12:39 in the morning. She had a total quantitative blood loss of 525. She was started on Pitocin at 2 units and were increased every 30 minutes. Some medications she received during her delivery were TXA and Methogen to prevent hemorrhage, pain medications like Toradol and Tylenol. She did receive an epidural. She received Phenergan to raise her blood pressure after her epidural was placed, and she had 2 rounds of antibiotics penicillin due to her being GBS positive. Her past medical history was she had a history of gestational diabetes. She had PCOS and was taking metformin. She was GBS positive. She had asthma, and my psychosocial concerns were she had anxiety and depression but was not on any medications. I was able to collaborate with the lactation consultant, and we were able to discuss their role in providing mothers with support and resources for their breastfeeding journey, how they help get a strong, comfortable latch. They help teach different breastfeeding positions. They also help set up pumps and ways to help increase milk supply. They are also able to assess babies for any tongue ties and assess for tongue range of motion and the jaw alignment as well as the suck strength. And then for my patient, she was a new mom and she really wanted to breastfeed. And so I was able to see the lactation consultant interact with her and help her reduce her anxiety, answer all her questions. She was able to ensure a deep, comfortable latch. She gave her many tips on how to increase her milk supply and gave her different positions that she can use while breastfeeding, and gave her some nipple creams, nipple shields to help prevent any cracking or any blisters or any discomfort. Nurses play one of the biggest roles in breastfeeding, which is helping with that first latch after birth, regardless if lactation consultants are present. They also play a role in helping set up breast pumps, teach about hand expression and the importance of colostrum, educating on second day syndrome, and educating upon discharge about the booklets that have online resources they can use if they have quick questions about breastfeeding, such as kellymom.com and lactationeducationresources.com. Next, I wanted to talk about the benefits of breastfeeding, especially the benefits for both mom and baby. So through research, I was able to find that for the mom, breastfeeding can help lower the rates of diseases such as high blood pressure and diabetes. It can help reduce postpartum hemorrhage by breastfeeding helps contract the uterus. It can also decrease depression if breastfeeding is successful. It can promote weight change and it could promote bonding, of course, and feeling of accomplishment and empowerment. For baby, the benefits of breastfeeding is it's easier to digest, it's the right amount of nutrition, it provides antibodies and builds an immune system as well as reduce the risk of chronic diseases. My second interpersonal collaboration was with the midwives. I decided to collaborate with the midwives due to my concerns for my patient's mental health. As mentioned in her medical history, she had previous history of anxiety and depression, which increases her risk of getting postpartum depression. And I was able to identify that midwives have a very distinct role in women's health. So I'll go over their role. They provide regular visits to monitor women throughout their pregnancy. They provide physical exams, ultrasounds, and blood tests throughout their pregnancy. They provide a holistic approach throughout their pregnancy and during their delivery. They help deliver the baby and provide newborn care. They help educate new moms on nutrition and lactation. They also talk about fertility. They also provide birth control, exams, and screenings. And then moving towards the postpartum aspect, they schedule a 2-week postpartum visit and then a 6-week postpartum visit. And then they screen new moms using the Edinburgh and GAD-7 once a trimester and at 2 to 6 weeks postpartum. Unfortunately, I wasn't able to see the actual services they provided specifically for postpartum, but I will discuss a brief overview of the services that they do offer. So midwives are able to do prenatal care, labor, and postpartum care. So for prenatal, they're able to confirm and date the pregnancy. They help prepare moms for their expectations during their labor, and then during labor, they help monitor the mother and the fetus. They assess the labor progress. They help with pain management and then ultimately deliver the fetus and placenta. And they provide a very individualized approach. They attend to whatever the mom requests or needs. It's a very holistic approach. They also offer postpartum care. They help educate on breastfeeding and postpartum recovery and mental health. When speaking to the midwives, they mentioned some online resources that they offer for any mom, but specifically for those who are at risk for postpartum depression. Some sources include the prenatal mental health support resources. They offer counselors, support groups, providers, training information. They also have a suicide hotline that they can use through this resource, and they have the ACOG depression during pregnancy, and this has frequently asked questions that they can view to see if they can get them answered through there. When speaking to the midwives, they help determine that the nurses play an important role in providing rest, encouraging patients to ask for help and ask questions. It's important for nurses to just show up, listen, and treat the patient to their individualized needs. It's important for them to provide a holistic approach to care, advocate, and encourage the patient to ask for help, as well as identifying early symptoms of postpartum depression and assessing for any risk factors. So for my research, I wanted to review the signs and symptoms of postpartum depression. I think it's important for nurses to review these early signs and symptoms to mothers, to first-time mothers, partners, and family members. Some symptoms include depressed mood for most of the day, loss of interest or pleasure for most of the day, feeling of guilt and worthlessness, loss of energy or fatigue, suicidal ideation or attempt or recurrent thoughts of death, changes in appetite, inability to concentrate, difficulty bonding with the baby, crying more than usual. I believe educating about postpartum depression can make mothers seek treatment that they need and help identify these early symptoms as soon as possible. We will now move on to discuss some recommendations for quality improvement. My first recommendation for quality improvement is I believe moms and first-time moms will benefit from a telephone checkup with a lactation consultant to help review their breastfeeding progress, review questions and concerns, and assess for any risk of early breastfeeding cessation. These frequent calls can help increase excessive breastfeeding as well as boost confidence. My second recommendation for quality improvement is increasing staffing to provide a 24-hour lactation consultant. I was talking to the lactation consultant, and she mentioned that when they first arrived to their shift, they tried to visit the first-time moms and babies born during night shift. Unfortunately, these moms and babies are missing out from the services that they provide. This is where nurses play an important role in assisting with the first latch soon after birth. Implementing a 24-hour lactation consultant can help improve mother's breastfeeding journey. My third recommendation for quality improvement is implementing nurses to utilize the postpartum screening tool, the Edinburgh Postnatal Depression Scale, on admission for all postpartum mothers. I believe this tool should be implemented in hospitals and have nurses utilize them to identify early signs of postpartum depression. These early screens can help mothers express their feelings freely and help validate their feelings. I also believe this tool should be used on all mothers. My fourth recommendation for quality improvement is improving communication with the care team about any potential signs of postpartum depression and assessing for any suicidal thoughts. I believe identifying these signs and reporting to the appropriate team member can be a pivotal moment in these mothers' lives. Unfortunately, many of these early signs can often be overlooked and can lead to worsening outcomes. Having the care team be informed about these signs and symptoms can help implement interventions early on, such as counseling, education, resources, support groups, and perhaps even starting on medication, which can have a huge impact in these mothers' lives. And these are my references, and this concludes my presentation, and I thank you for your time.